Senator Patty Murray didn't just call out Republicans. She exposed the entire strategy behind their healthcare delay. And once you understand what she's pointing to, you'll see why millions of Americans are about to face higher premiums and why this crisis was completely preventable. Let's break down what really happened here.
Senator Collins, Senator Murray.
Oh, thank you very much, Chair Cassidy. You know, we got to be real here. We are a month into open enrollment, a full month. The time to save people from these huge increases in costs they're going to see because the ACA tax credits expired was before these premium hikes were all but locked in, saying, let's start talking about fixing this now, a month into open enrollment, instead of at any point earlier this year when we actually had time to stop premiums from skyrocketing or look at some of these different reforms. You know, this is about as serious as expressing concern about RFK Jr.'s anti-vax crusade after voting to make him the most powerful public health official in the country. The time is out. Realistically, the only way now we can stop people from seeing these huge increases is a clean extension and a longer open enrollment. And I think we should be honest about that. I appreciate, Mr. Chairman, the ideas being tossed around, even if I have some concerns with some of the proposals. But if Republicans had come to the table at any point earlier this year, there would be time to sit down and talk about this. But we have now seen the Republicans run out the clock. They blew right past the start of the open enrollment. Forget about time spent negotiating. Even if we passed this bill today, there is not time to implement anything more complicated than a clean extension. So if Republicans are serious about preventing the mega healthcare hike, they should work with us right now to pass a clean one-year extension as fast as possible, literally right now. And if their call for reforming tax credits is serious, we should look at that. We can talk about those reforms ahead of the 2027 year. But I have to say, I am not optimistic that most Republicans are serious about this because they refuse to talk about this problem before right now. And I've been down this road before. During the Trump administration, the first one, I sat across from Chair Alexander. We hammered out a bipartisan plan to lower costs. We were on the one-year yard line. And then a call came down from Trump and Republican leaders. They did not want us to get to a deal. They didn't want to help us lower healthcare costs, and they started demanding restrictions on abortion, something that had never been an issue before in our talks until then, and used that pretext to torpedo months of bipartisan negotiations. So excuse my skepticism today when we've seen this tired playbook. If Republicans want to talk about health care, Mr. Chairman, great. Unfortunately, we've heard many Republicans make it clear they're not serious. But if that changes, Mr. Chairman, I'm at the table. I am at the table. I'm ready to talk about our healthcare system in this country. So, Dr. Fegan, let me talk to you. Did any of the cuts Republicans made in their reconciliation bill this summer make healthcare more affordable for American families?
They did not.
Can you tell us why?
The reality is that when we we make people pay more for their deductibles, that they don't get care. The reality is when we say we're going to give them a medical savings account, the only choice patients have is to purchase health insurance. And so it puts them right back in, when you're purchasing health insurance on an individual basis, it's more expensive than if you're having part of a large pool. When you have to, only way that you get a cheaper price is when you agree to have greater deductible or greater out-of-pocket expenses, and you have fewer choices. So they didn't save any money, and giving the money to the patients doesn't help the patients make better decisions.
Okay, and I've heard a lot of discussion about coverage more affordable for small businesses and employers. I think what is important to acknowledge is that nearly half of the adults within the ACA marketplace are small business owners or employees or self-employed, and letting these tax cuts expire is going to hurt them dramatically. And Mr. Chairman, before my time is up, I do want to note that tomorrow, CDC's vaccine committee is meeting to discuss the childhood vaccine schedule and the hepatitis B vaccines. Something the chair of this committee has said many times saves lives. The CDC Advisory Committee is going to hear from who knows who, but based on the fact that the CDC's own website now spreads anti-vax disinformation, I want to state for the record, I am deeply alarmed this committee has not done more oversight, and we still have not done a thing to force RFK Jr. to come here and answer questions about his decision to fire the CDC Director Menares and limit access to life-saving changes. Mr. Chairman, I hope that will change.
What you just watched from Senator Patty Murray isn't just frustration, it's a moment of absolute clarity about how healthcare policy actually works in the real world outside the political theater, and that's what people often miss. When lawmakers delay action on something as structural as ACA tax credits, they're not just stalling a bill. They're allowing the system's built-in pressures to take over, pressures that translate directly into higher premiums, higher deductibles, and more families pushed to the brink. Murray is essentially telling the country, the clock ran out, and that wasn't an accident. Insurance companies don't wait for Congress. Premiums get set months in advance. Actuarial tables get locked, coverage plans get finalized. Once open enrollment begins, the consequences are already baked in. So when she says Republicans ran out the clock, she's pointing to a tactic that has become familiar in Washington. Avoid acting until inaction becomes irreversible, and then pretend the crisis appeared out of nowhere. And what makes this moment hit harder is Murray's reference to history. She brings up the Trump-era negotiations where a bipartisan deal was literally at the finish line and suddenly derailed by a political demand that had nothing to do with the work they'd done. That tells you this isn't about policy disagreement. It's about refusing to let Democrats notch a win on healthcare, even if it means millions of Americans pay more. And for the viewers, this is where you should question political seriousness. Healthcare isn't like arguing over a messaging bill or a symbolic resolution. This is the system Americans rely on every single day. Seniors, parents, gig workers, small businesses. When Murray says nearly half of the ACA marketplace is made up of small business owners and self-employed people, she's blowing up the right-wing myth that the ACA only serves some fringe population. These are the backbone workers in the economy. Letting their tax credits expire is essentially raising their taxes at a moment when costs for everything else, housing, groceries, childcare, are already squeezing them. But maybe the sharpest moment in her remarks is about the broader public health danger. When she points out that the CDC Advisory Committee is now forced to operate in an environment where anti-vax disinformation is coming from inside federal leadership, she isn't just criticizing incompetence, she's signaling a national security problem. Vaccination schedules save lives. Undermining them isn't politics, it's playing with the structural defenses that protect children. And this is why her skepticism matters. She's saying, in plain terms, if Republicans were serious about healthcare, they would have acted when action mattered. Not when cameras are rolling, not after premiums are locked, not after families are already opening letters with big increases. This is the kind of moment that tells you exactly who is doing the governing and who is only performing it. And that's why these hearings matter. They reveal the difference between lawmakers who want workable policy and lawmakers who want leverage. Murray is calling it out because Americans deserve to see the truth, not the rehearsed rhetoric. If you're watching this, the takeaway isn't partisan, it's structural. Delays cost money. Inaction has consequences, and political games on healthcare hit real families first, always. If you appreciate analysis that digs deeper than the surface-level sound bites and actually helps you understand the stakes behind these moments, make sure you subscribe to Left Lens. We break this down every single day so you don't just watch politics, you understand it. If you're getting value out of this level of analysis, hit that subscribe button, tap the like button, and share this video so more people can understand what's really happening in Washington. Left Lens is here to cut through the noise, but we can't do it without you.